For the next aspect in pregnancy which we'll be looking at palpation of the fetal outline. So palpation of the fetal outline. So palpation of the fetal outline is more of like a technique, alright, a skill, a hand skill, because a woman has a baby. I can do an ultrasound to look at this baby and it's easy. But what if I find myself in a community where there's no ultrasound? So for medical students, they teach you to actually, get the skill. So when you get the skill, you can just be using the ultrasound as, a joke, right? Because you as a person, you have the skill. With or without the ultrasound, you exist. You understand? So this is actually a thing, right, that will teach you practical, but we can just discuss the theory aspect here so that I get an idea of what it is. So it's just a clinical technique. It's used during pregnancy to assess the position, to also know which part of the baby is presenting. Now, as the mother is going towards giving birth, you want to know, is it the head or the back of the baby or the buttocks of the baby that is presenting? Now, this will help you to know if there is a possibility for vaginal delivery. Okay, so you are trying to check out for the shape of the baby, through the mother's abdomen. So you are not looking at the main baby just from outside. You are having an idea. So what is palpation of fetal outline? So you are trying to check out how the baby is lying. You are trying to see the presenting part of the baby. Is it the head or the buttocks or the back, like I earlier told you guys? You're also trying to look at the position. You're also trying to look at the attitude, degree of flexion of the fetal head or limbs. Okay, so can you see? Can you see? Can you see it? Please, you can pause at any places I show the picture so that I can just focus on it. So how is it done? It is part of the obstetric abdominal examination. You use what? The Leopold's maneuvers. First maneuver, second maneuver, third maneuver, fourth maneuver. The first one is the buttocks. Okay. Second one, you are feeling the what? Leg and back. Third one, you are feeling what? Trying to like feel the head. Then fourth one, you are feeling the head very, very well. Okay. So fundal grip identified what? The fetal part in the upper uterus. I'm not saying it must always be the buttocks in the upper uterus. Okay. But just feel the upper uterus first. Okay. Lateral grip, pelvic grip, then head engagement check. So clinical value guides decision to know if a woman will be able to deliver through the vagina or it is cesarean section. Can also dictate abnormalities like breech presentation, alright, or multiple gestation. That one is not an abnormality though, but you are trying to check if it is one baby or twins that a woman has.